Hello, welcome and namaste everybody. We'd like to welcome you all in our weekly follow-up session of SIP Module 2, Holistic Human Health. We have our near and dear Dr. Akhilesh Shukla with us. Ji Akhilesh Bhaiya, namaste.
Namaste, Bhaiya.
Namaste Bhaiya. What we are going to discuss today, Bhaiya?
Yeah, we will discuss about the low back pain.
Ji,
The last session on November asked to discuss about the low back pain, so we will discuss about it.
certainly. So, welcome, Bhaiya. We can start in a minute or so. Ji.
Ji Bhaiya.
Sure.
भैया नमस्ते।
दीदी नमस्ते।
हाँ जी भैया, कैसे हैं आप?
दीदी मैं बहुत अच्छा हूँ, आप कैसे हैं दीदी?
बस बढ़िया, एवरग्रीन आपकी वजह से।
जी।
आप इतना अच्छा गाइड करते हैं तो फॉलो करने से ही हम एवरग्रीन रहेंगे ना।
जी बहुत बहुत धन्यवाद दीदी।
जी भैया धन्यवाद, आपको भी आशीर्वाद है।
जी सब भगवान का आशीर्वाद दे दीदी। आपसे एक्सपीरियंस सुनना है हमको कि आप कैसे सब कुछ मैनेज कर रहे हैं अपने लाइफ में।
जी हम भी कर रहे हैं, रोज नया नया एक्सप्लोर करना होता है।
जी
Ji Akhilesh Bhaiya, we may start now formally. So, again, welcome all. Ji, over to you, Akhilesh Bhaiya. Namaste. Welcome.
Thank you Bhaiya. Thank you so much. So welcome all of you in this holistic health session. So in today's session, we will discuss about the lifestyle to prevent and manage low back pain. Is one of the very common problem seeking for the leave from the job, and it is one of the common cause of disability. It may not be very fatal for the life, but it causes a lot of suffering to the person. So we will discuss in bit detail about it. So knowing about the low back pain. So low back pain is the leading cause of disability. So it will make the person suffer. The person will unable to do his daily routine. He will unable to go to his job. So it is one of the very common cause of disability and most common reason for medical consultation. So many of the people, they visit to the physician or orthopedician going with this particular complaint of low back pain. And most common cause for patient to seek emergency care, and many times the person will develop back, unable to sit or unable to drive or unable to go to the work, and he will in need of emergency leave. And the low back pain, there is no specific age that this age person will suffer from this particular problem. Even the children, adolescent, adult, old age, all age groups, they suffer with this particular problem. And almost everyone will experience low back pain at some point of time in their life. So you can say that the prevalence is almost 100%. So everyone in some point of time in their life, they will experience this low back pain. And the recurrence is very common. It is not that only once the person will suffer. Repeatedly, the person will suffer depending upon his job, depending upon his lifestyle, and kind of structural abnormality which has occurred. So there will be very common recurrence of this particular problem. So to understand low back pain, we have to understand little bit about the structure of our back. So there are many different structures in our back to support our body, and the problem in any of these structure may cause low back pain. So we will know a little bit about the anatomical part, anatomical part of this particular problem. So there are 4 regions of the spine. Cervical region, generally this is the back of our neck. Then thoracic region, we also say it as the dorsal region, that is back of our. Then lumbar area. So low backache, when we say, it is generally related with our lumbar spine and the sacrum and coccyx. So these are the 5 areas: cervical, thoracic, lumbar, sacrum, and coccyx. So there are 33 vertebrae. So vertebrae are the short bones, and they are arranged in one series. So first there will be cervical vertebra, which are 7 in number. Then thoracic vertebra, there are 12 in number. After the thoracic, the lumbar vertebrae are there. They are 5 in number. Then sacrum. Sacrum is again 5, and coccyx, that is 4 in number. So altogether it becomes 33 in number. And actually this coccyx, they fuse together, and even the sacrum, they fuse together. The sacrum 5 and the coccyx 4, they fuse together, and it will become 1. So in the childhood, they all will be separated, but as the person grows with the aging, these all will fuse together. Then spinal cord. Spinal cord is the bunch of nerves, and it is continuation of our brain. So from brain, this spinal cord will continue, and this spinal cord will be protected by these vertebrae. In the vertebra, we have central canal through which this and this is hard bony structure which will protect our this spinal cord, and this is continuation of our brain. Then there are various muscles which support our back. There are various tendons, ligaments, which keep all these vertebral column in particular place, and it will help for the movement. So in between the vertebra, we have intervertebral disc. So intervertebral means within the in between the 2 vertebra, there is one spongy part which we say as intervertebral disc. So this is cushion-like pad in between the vertebra, and this vertebra is spongy, and it acts like a shock absorber. So like whenever we are doing movements, we are jumping, we are running, or we are bending. So these vertebrae, they are hard structure, and in between the hard structure, there is a very soft structure which will act like the shock absorbers. Then there are ligaments. Ligaments, they are connected with the bone to bone. So these ligaments, they will keep the vertebrae in particular place so that they should not move or they should not get displaced. Then there are tendons. So tendons are the continuation of these muscles. So the muscles will connect to the bony part through a cord-like structure, which we say as the tendons. So these all are the supporting anatomical structure of our back. So when we say about the low back pain, so low back pain may arise because of abnormality or because of some structural problem in any of these structure. There may be problem related with the vertebra, there may be problem related with the spinal canal, there may be problem with the spinal cord, there may be some kind of problem in the intervertebral disc, which is acting like the shock absorber. There may be problem with the ligaments, there may be problem with the tendons, there may be problem with the muscles. So any of these problems may create, there may be one or multiple altogether also. So whenever some abnormality occurs in these particular supporting structure, then there will be back pain. The person will experience back pain. So these all are the pictures. So as I told that this is just for nape of the neck. This is cervical spine. Then this, the back of the chest. This is thoracic region. It is also called as dorsal region or the dorsal spine. Then this is the lumbar spine. This is the most movable part, our neck and this lumbar. This is the most movable part. So we move our neck and we move our back whenever we are bending, twisting, we solve. So most of the people, they will suffer with some kind of problem related with our neck. So neck pain or the cervical pain generally we say, and this lumbar pain generally we say it as low back pain. This is the spinal cord. So you see this, the brain is continuing here. And in this, these all are the vertebra, the cervical, thoracic, lumbar, sacral, coccygeal. These all are the vertebrae. And in this vertebra, there is a central canal. So this spinal cord is carrying with this central canal. So there are 31 pairs of nerves which arises from this spinal cords and which supplies to all over our body, limbs, etc. That all are supplied by the branches which arise from this spinal cord. We'll see the further. So we discussed about the intervertebral disc. So this is the intervertebral disc. So in between these two vertebra, this is the vertebra, this is another vertebra, and in between this, the bluish color which you see in this picture, that is the intervertebral disc. And this disc is acting like the shock absorber whenever we are performing some movement, jumping, running, or whatever the actions we are doing. So this will help to cause any kind of damage to the nerves or to the vertebrae. So it will be like the shock absorber. And here, this is the central canal through which this the spinal cord is passing through. And this is spinal cord. From there, the pairs of nerve arises. So this, what you see is the nerves which are arising and supplying to all our upper limb, lower limb, all these places. And these all are the ligaments. So ligaments, they are connected to the bones to bone. So they will keep these all vertebrae into particular place so that these vertebrae, they should not displaced. They should remain in their place. So these ligaments, they are helping in that. So you can see the single vertebra, how it looks. So this is the spinal cord, which is, and this whole area, which is the central canal of this vertebra. And these all are the spinal nerves. So pair of nerves, they are arising. So there are total 31 pairs of nerves which are arises and which are supplying to all over our body. And this is the intervertebral disc. So in the central part of this disc, there is a nucleus pulposus. Nucleus pulposus. So pulpus, the word itself means a very spongy jelly kind of things. And this is annulus fibrosus. So annulus fibrosus is the fibrous structure. So these in between the pulpus structure is again protected by this annulus fibrosus. So this is intervertebral disc which support any kind of shock or whenever we are doing some activities. So it will act like the shock absorber or like the spring we have in the bike. We have the spring which will protect it from any jerky movement. So similarly, it will from any kind of jerk, any kind of movement, it should not cause any trouble to the vertebrae or to the nerves. So these intervertebral discs, they will act like the shock absorber for the spongy structure. These are. So further we can see here. So this, the first one which we are seeing, this is the normal disc, and this is the degenerative disc. Degenerative disc, that means the sponginess will goes on reducing. So degeneration may occur because of the aging process also, and it may be because of our faulty lifestyle or because of our wrong postures, which is causing extra pressure to our spine. So these all may lead to degeneration of the disc. And whenever there is extra pressure or overload to our vertebrae, then because this is very gelatinous part, this is spongy part, so sometimes these discs will bulge. So here what you see is little bit bulged disc. Then there may be herniated disc or herniation of the disc. So when there will be too much pressure, then these nucleus pulposus that will completely coming out, and the fibrous structure that will completely, it will displaced. So here it will herniated disc. When this herniation will occur, the pairs of nerves which are arising from this particular area, they will be compressed and there will be pain in that particular area. So when the bulge disc is there, the pain will be little less, and sometimes it will reduce because of the rest or when the spine is in the normal posture. But when the disc is herniated, there may be chance of continued pain in that particular area wherever these nerves are supplying. Then there may be thinning of the disc. So the disc, this is the normal disc, and here it is very narrow. So thinning of the disc, that may happen because of the age and because of many other reasons. And here it is degenerated disc and with osteophytes. So the vertebra, they also go degeneration, and they go degeneration, there will be chances of formation of osteophytes. So these osteophytes will further cause trouble. They will compress our bones, or they will again damage our disc. So these are the various kinds of abnormalities which may occur in our intervertebral disc. So here there is one picture. What you are seeing is spondylolisthesis. So spondylolisthesis is nothing but the displacement of the one vertebra over the other. So here the vertebra which you are seeing, it is completely displaced from its position. So this is the normal. Here what you see is the normal position of the vertebrae in the left side picture, and here what you see here, this is the vertebra which is displaced from its position. So this we say, this condition we say as spondylolisthesis. So when one vertebra is displaced completely from its position, that condition we say as spondylolisthesis. So these all are the various kinds of problem which may happen to our disc or vertebra, and these problems will lead to low back pain. There are certain muscles, these are the groups of muscle which are protecting our back and keeping helping for all kinds of movements. So there may be some sometimes muscular spasm, or there may be strain or sprain which may lead to back pain. So this back pain is, so back pain we also say it as backache or lumbago. And low back pain is defined as pain and discomfort localized below the costal margin and above the inferior gluteal folds, with or without leg pain. So this low back pain is a very general term which we commonly say, and there may be various reasons, and depending upon the particular kind of anatomical abnormality, different diagnostic terms are also used. But in general, when we say low back pain, it is the pain which is below our costal region. So costal region, what I just shown here, this is our thoracic. So below this region, mainly this lumbar region. So that reason, when there is some kind of problem, that we refer to as low back pain, and it is above our gluteal fold. Gluteal is nothing but our buttock region. Above our buttock region and just below our dorsal region, the pain which is there, that we refer to as or that we say low back pain. And it may be associated with leg pain or without leg pain also. So that means the pain will be localized only to that particular area, and there will be no referred pain or continued pain over lower limbs. Or sometimes it may happen that because of some nerve compression, the pain will continue to our legs also. So the lower limb, we also feel it may be one side or it may be both the lower limbs. It may be possible depending upon the kind of herniation and kind of compression which is happening. So the person may have pain on only one side, or he may have pain on both the legs, or it may also possible the pain will not be in the legs, but it is just localized only to the below the costal region or below the dorsal area and just above the gluteal area. So that particular area, when there is a pain, that we say as low back pain. The most common form of low back pain is the one that we call as non-specific low back pain. So this is the most common kind of pain. So when we say that non-specific low back pain, that means it is very difficult to identify what kind of structural abnormality is there or what kind of causes are there, why the person is suffering with this low back pain. So there will be no particular cause, or we cannot say that this is because of the muscle, this is because of some kind of problem in the ligament or in the vertebra or the intervertebral disc or any other the tendon or anything. So when there is no particular cause to say that why the person is suffering with this low back pain, that kind of pain we say as the non-specific low back pain, and this is the most common kind of pain which the physician or orthopedician get in their clinical practice. So there will be no particular specific pathology. So we will see the common risk factors or who are generally suffer with this particular problem. So the people who are physically inactive. So when they are physically inactive, their muscles activity will be less, and when the muscle strength is less, then the vertebral support that will also be a little bit weakened. So when there is a weak muscle, weak ligaments, tendons, so there may be chances of having low back pain because of the weak support to our back. Then overweight and obese. So this is another cause. When the person is overweight or obese, so there will be extra load and the whole back will be having extra pressure. So because of that, the person may suffer with low back pain. And job that requires heavy lifting, pushing, pulling, or twisting can cause some kind of problem in our low back. So related with job, the person's job is such where he has to involve in a lot of physical activity, he has to carry heavy weight, he has to lift, or he has to push. So these all kind of mechanical work when he is involved in. So there may be chances if he is not very careful or he is not aware how I have to, what kind of position I have to take when performing this kind of physical activity. So some wrong position may cause extra pressure to our low back, and because of that there may be chance of any kind of structural abnormality and the person will suffer with low back pain. Then there are certain psychological stress, so poor sleep, depression, anxiety. So as I told that there are large number of cases of non-specific low back pain, and the cause may be of the psychological stress, depression, anxiety, such thing the person will suffer with low back pain. Then advancing age, specifically after the 45 years of age. So this happens because of the degenerative changes which are going on in our body. So there will be a kind of natural degeneration also, and there may be early degeneration also when the lifestyle is not good, the food habit is not good, the posture, he is not aware of the posture in which he sit or do the work. When such things are there, there may be early degeneration of the bones and the disc, or there may be gradual degeneration also. It is happening in our body. So specifically after 45 years of age, the chances of having low back pain is a bit high. Then there are some hereditary causes also. Some hereditary problems may happen in our back or the spinal cord, and because of the abnormality, the person may suffer with low back pain. Then what are the general causes of this low back pain? So there may be muscle spasm. So when we take sudden movement or sudden jerky movement, so there may be chances of muscular spasm, and this muscular spasm may cause back pain. Then sprain, an injury to the ligament. So ligament, I told that which supports bone to bone. So these ligaments, they will keep the bony structure into the particular place. So when there is this all sprain, strain, that all happens because of the sudden or jerky movement or sudden lifting a weight without being aware of the particular position we have to perform this task. So when such things are happening, there may be sudden spasm or the sprain the ligament, or there will be strain to our muscles and tendons. So tendons are the continuation of these muscles and the card-like structure which will connect the muscles to the bones. So that we say as the tendon. So in the tendon also there may be chances of having some kind of problem because of sudden jerky movement or sudden jump or sudden any kind of activity, twisting. So these all may cause such kind of problem. Then degenerative disc diseases. So as we have seen just in the pictures, that there will be degeneration. Natural degeneration may also occur, and there may be early degeneration also. So these degenerative disc disease, because these discs, they act like the shock absorber. So when the disc are generated, so there will be extra pressure, and this pressure will cause some kind of sensation to our nerves, and the person will suffer with low back. Then herniated or ruptured disc. So when there is a degeneration, the chances of herniation, chances of disc bulge will be very high, and sometimes it may happen that the disc may be completely ruptured, thinning of the disc. So these all are the causes which cause compression to the nerves which are arising from that particular area. So it generally, this condition we see in our clinical practice mainly occurring in our cervical region and lumbar region, because these are the two areas which we have maximum movement. Then already I told that the displacement of the vertebra will be displaced from its own place, and that is happening because of the some kind of injury to the ligaments, or there may be loose ligaments. So that may displace the vertebra, and this will cause severe pain. Then spinal stenosis. So when this spinal cord, which is passing through the spinal canal or this vertebral central canal, when this canal is narrowed, so this will cause compression to the spinal cord. So that condition we say as spinal stenosis. There may be chances of scoliosis. So sometimes the scoliosis may happen because of some hereditary problem also. So there will be bending of the spine towards the left or towards the right. So anything may happen. So it will not be the normal shape of the spine. The normal shape of the spine is like S-shaped, the English S word. So like this, it is slightly S word. This is the shape of our spine. So when because of some hereditary problem, or because of the wrong posture, or because of any injury, it shift to left, right, in this kind of display. So that condition we say as the scoliosis. Then ankylosing spondylitis. So this is one of the autoimmune problem, inflammatory condition of our spine. So where here what will happen is these vertebrae, they will goes on joining together, what we say is the bamboo spine. The vertebra, the movement will be completely lost if the person is suffering with this problem, and the vertebra will join together and it will become very stiff. So the person will unable to bend, unable to move, unable to twist. So such kind of problem may happen because of the ankylosing spondylitis. This is autoimmune problem. One of the very common thing that we know is sciatica. So sciatica nerve is there, which arises from our lumbar and sacral region. So there, from there, this sciatica nerve is originated. And when there is some problem in our fourth or fifth or sacral vertebra, so it will cause compression to this particular nerve. And this sciatica nerve is supplying to our posterior part of our legs. So when there is a problem in this, some compression is happening in the lumbar or sacral area, then this will cause compression to our sciatica nerve, and there will be continuous pain to the person. Person will have pain from low back till his whole posterior aspect of his leg. So this radiating pain, when he is having, that we say sciatica, because it is the compression over the sciatica nerve. So the disease is diagnosed as sciatica. Then several medical conditions are there which may result in back pain. Sometimes it may be infection to the spine. There may be some kind of problem in our kidney. It may not be the problem of our low back. There will be kidney stone, and this, the stone, the referred pain the person will have on his low back. So the person will feel pain on low back, but the exact cause of this will be the presence of stone in the kidney. Then pregnancy. So pregnancy is also the woman, when they are pregnant, the growing fetus. So because of this growing fetus, the female may have may suffer with low back pain. Another cause is the some kind of problem in gallbladder or the pancreas. The person will have a referred pain on the back. So we have to particularly see whether the person is having this problem in the low back or the problem with the liver or gallbladder or the pancreas. So sometimes these pain referred and the person will complain that he is having pain in the low back, but it will not be exactly the low back pain, but the cause will be problem in his gallbladder or his kidney or maybe in the pancreas. So sometimes the females, when they are suffering with endometriosis or ovarian cyst or sometimes uterine fibroid, which is becoming one of the common problem, or sometimes even the malignancy or the cancerous changes which are happening in the uterus or ovaries. So in these conditions also, sometimes there will be referred. So patient will complain that she is suffering with the low back pain, but actually the cause will be something else. And again, when the person is having some kind of accident or some kind of injury, or he fell down, he slept, because of the sleeping or any this kind of problem or extra compression or some kind of injury or anything, that may cause fracture of the spine. And there is one more condition we say as the Pott's spine, that is the tuberculosis, TB spine. So tuberculosis is not occurring just in the lungs, but it may also occur to our spine, and that condition we say as the Pott's spine. So these are the several causes because of which the person may suffer with the back pain. See, when we are discussing so many causes, but actually the most of the people or most of the patient, those who visit to the doctor, actually all these severe problems what we discussed about the cancerous changes or the ankylosing spondylitis or the spondylolisthesis or herniated disc or central canal stenosis. These all are the big diseases what we just very few cases those who are having this particular problem and coming to the doctor. Most of the cases they are suffering with the back pain because of some very common problem. There may be some jerky movement and it will be the muscular spasm. The person will suffer with back pain, and most of the cases there will be slightly disc bulge because of his abnormal sitting posture, or he is not properly aware when he is carrying load or lifting some heavy weight. So there may be some slight disc bulge, there may be some muscular spasm, there may be some strain, sprain. Actually, most of the cases, those who come for the back pain or those who have back pain, they are related with this particular group. And only very few, maybe less than 1% cases, they are of some severe in nature, where we have to go to some detailed diagnostic or investigation. The person may be having some other issues which may not be directly related to back pain, or maybe related with back pain but having some severe kind of pathology. So most of the cases are they are coming with all these very common problems. Then the types of back pain. These types of back pain is based on the duration. So the first category is the acute back pain. So last a few days or to a week. So the person will have sudden back pain, and again the cause may be some jerky movement, sudden jump, suddenly lifting heavy weight, some or some kind of sprain. So because of these reasons, suddenly he will develop low back pain, which will last for a few days or maximum to a week. Then the subacute back pain. So it will be for 1 month to 3 months. The person will be having pain, which will be for the 4 to 12 weeks. So he will suffer with 1 to 3 months. Then the chronic back pain, which will be more than 12 weeks. So more than 3 months, the person will have back pain. May not be very severe in nature, and he will be having mild back pain, but it will be more than 3 months. So that kind of low back pain we say as the chronic back pain. So based on the duration, back pain is categorized into the acute, subacute, and chronic. So this is the important part, how to prevent the pain. Sorry, dear, suddenly disconnected. Are you able to hear me or able to see the slides?
Yes, Bhaiya, please continue, Bhaiya.
जी. Okay. So we were discussing about the preventive aspects. So one thing is regular physical exercise. So regular physical exercise will strengthen our back muscles, will strengthen our tendons, ligaments, so that even if we are carrying some heavy load, then also because of our strength of our muscle, we will not suffer with this problem. The another thing is when our muscles, these are very strong, so the vertebrae they will be in they will not be displaced. So they will be in particular place itself. So regular physical exercise will strengthen our back and the person will not suffer with the back pain. Then the maintaining our ideal weight. So overweight and obesity, that is one of the risk factor for low back pain. So we have to be careful about our diet and physical activities so that the person should not gain weight and become obese. Then stand and sit up straight. This is very important. Most of the people, those who are involved in the sitting job, so they have to sit for sometimes 6 hours, 8 hours or more than that. If their posture is abnormal, their posture is not correct, so what will happen is there will be continuous extra pressure to our, mostly our cervical region or our lumbar region. And this, when the person has to do the job and he's continuously sitting in improper posture, there will be continuous pressure to our low back. And after a certain period of time, as when the age is also growing, then the person will suffer with this back pain. And sometimes it may also happen that there will be some kind of displacement of the vertebrae. There may be herniation of the disc. So these all problems may happen because of the improper posture and continuous pressure to our spinal cord and this vertebra and intervertebral disc. Then another thing is avoiding lifting very heavy weight, or if we have to do it, so we have to bend from our knees. We should not bend from our low back, but we have to bend from our knees. If we are bending from our knees, the maximum the strength will be from our leg muscles and not from our back. So this have any kind of muscular spasm or any kind of extra pressure to our disc or spinal cord. So we have to bend from our knees and then we have to lift any heavy weight. So that little bit care is required whenever we have to lift some heavy weight. Another important thing is we have to wear right kind of footwear. See, in most of the female, the cause of this low back pain is the choice of this footwear because of the high heel sandals. So what happens is when the ladies or sometimes even the male, they will choose very high heel sandal that will change the whole angulation and that will change the whole weight distribution in our spine and our joints. And even the walking style will be not natural when the heel is of more than 1 inch or very high heel sandals. So that will change the whole angulation and there will be extra pressure to our low back. And if we are wearing such kind of sandal continuously, there will be continuously low back pain. And many a times we find in our clinical practice that it is the footwear which is causing the low back pain. So we have to be very careful and we have to choose right kind of footwear which we are wearing. Because again, the footwear will be with us for the whole day. Once we wear it in the morning, then we come back in the evening only, then we remove our footwear. Otherwise, the whole day we are using this footwear and continuously every day we are doing this. So if the footwear is of the wrong kind, not suitable for our height and health, then this will become one of the cause of low back pain. So we have to be very careful when we are choosing our footwear. Then we have to eat healthy food, avoiding stress. As we told, many of this are non-specific low back pain, and there may be some psychological factors and not be some anatomical abnormalities. Many times psychological factors may be the cause of low back pain. So we have to involve in various kind of yoga, meditation, etc. And we have to avoid stress. Healthy sleep. Healthy sleep is required. When we sleep, the whole body will go into the rest and whole body will get the time to regenerate or to go in proper rest and get ready for the next day work. But when we do not have the proper sleep, our back muscles, our spine will also not get proper rest, and that will again continuous stress, continuous pressure. So that may cause low back pain. So 6 to 8 hours healthy sleep is must for every individual. Then using suitable bedding. This is the another very common problem why the person is suffering with the low back pain. When we are using very cozy bed, very soft and cozy bed, what will happen is our spine will not be in the natural position when we are sleeping. Load over low back or over neck region, or if we are keeping very thick pillow. So that thick pillow, again, it will cause some extra pressure to our cervical region. Or when the bed is very cozy, the spine will not be in the natural position. When the spine is not in natural position, even in the night time, when we are sleeping, there will be extra pressure to our most of the time it will be in the lumbar region or the cervical region, and the person will suffer with some problem. So what we have to do is we have to use the very firm mattress, and we have to so that our spine will be in straight position, and we have to use a very thin pillow just to support our head region. Should not use very thick pillow. So this will give proper rest for our spine, and that way you can prevent the low back pain. Then take regular break to get up, stretch and move around. So at least every hour we have to get up. We should not continuously be in the sitting position. We have to wake up, we have to get up, and we have to take some slight move, walk for at least 100 steps, and then come back and again do the job. So continuously sitting, continuously being in the same position is not good for our back pain, is not good for our back. Then being aware of our posture. So we have to sit straight, and when we are walking, that time also we should be aware of our posture. So this will prevent extra pressure to our back, and it will prevent us from the low back pain. Then if the person is already having some problem with the low back, what are the things we can do? Then acute low back pain, which will last for a week. The person will have sudden muscular spasm, sudden jerky movement, or sudden lifting of heavy weight, and the person will suffer with back pain. In such kind of situation, we advise for the strict bed rest, lying on a firm surface for 2 to 3 days. So rest itself is a medicine for the back pain. And in the most of the cases, giving proper rest, that itself will resolve the problem. When the person is having acute back pain, we just advise him to sit on, to sleep on a firm bedding, and use a very thin pillow, or even if possible, don't use any pillow. Lie down in supine position, so your spine will be in the natural position, your whole back will be in proper rest, and this proper rest itself will solve the problem. And if required, then we use the hot or cold compress. Sometimes we just advise to have this hot water bag and just have little bit sedation from this hot water bag, or go for this cold compress. That will help to get rid of the pain. Then controlled exercise. So this is controlled exercise. When the person is having back pain, he should not just do all kinds of exercise. There are some certain movements which will relax our back, and even if there is some extra compression over the disc, if there is a slight disc bulge, so some guided exercise, guided yoga postures, that will help to reduce the pressure over our back. So generally we advise the Shalabhasana, Bhujangasana. These all are asana which helps to get rid of this back pain. Then meditation to reduce the stress. This is very helpful as maximum number of cases are non-specific. There will not be any kind of anatomical deformity. So we advise to go for meditation and relax, avoid stress. That itself will solve the problem. Then if the person is having constipation because of the excess straining also, sometimes the person back pain will further aggravate. So if required, if the person is having uh, constipation, passing hard stool, so we suggest to go for some herbal mild laxative so that he will not be having trouble or overstraining during the time of defecation. There are several research work suggest us that the yoga therapy or certain guided yoga practices, they will help to get rid of this low back pain. Some randomized control trials are there, which proves that yoga practices, they are highly helpful in managing or in the treatment of low back pain. Then again, certain meditation practices that also proved to have beneficial effect on pain. So focused meditation, then several meditation therapy, guided meditation. So these all will help us to get rid of low back pain. The important thing here is when to visit a doctor. So low back pain that does not respond to the home treatment even after 2 weeks. So suppose you have taken proper rest and you are following all the initial advices and still there is no relief, then it is the time to visit a doctor. And the pain is affecting doing normal day-to-day activities. So the person is unable to perform, the pain is very severe in nature, he is unable to move, unable to do his daily activity, then there may be chance that some severe kind of problem may have happened, some disc bulge, disc herniation, or some kind of problem may have happened. So it is important to go and visit a doctor. Then when the pain is very severe in nature and getting worse in time. So pain is very intolerable, and again subsiding of pain even after rest, even after cold hot sponging, nothing is happening. The pain is severe in nature and it is continuous. So that is the time when we have to go to a specific orthopedician, physician, or doctor, whoever is there nearby. Then person is unable to sleep and even move or go to washroom due to pain. So his sleep is completely disturbed and he is unable to have proper sleep, unable to go to the toilet, unable to go to the washroom. And even moving in the bed itself becomes very difficult. So that is the time we have to go to the doctor. And pain is continuous in nature and no relief even after proper rest. So as I told that the rest itself is one of the medicine for the low back pain. But suppose even after proper rest, there is no relief at all, the pain is same and continuous, then we have to go to the doctor and take proper advice. So this is in short about the low back pain. And again, like various reasons are there. One of the very common reason is the sciatica, or there will be disc bulge, there will be herniated disc. So these all are the specific cause of low back pain, and it again require some discussion. So whatever we discussed in today's class is basically about the non-specific low back pain and its prevention and management. So anyone would like to share something or have any query, so they may please ask.
Yes, भैया नमस्ते भैया
जी दीदी।
नमस्ते भैया
जी दीदी
for
नमस्ते।
such a insightful session. Bhaiya, I have only two questions.
जी
One,
प्लीज।
like how to overcome these abnormalities, and second one is like, is arthritis also related with this?
Can you please repeat the question?
First question is how to overcome these abnormalities that are coming.
Okay.
And second question is arthritis related with this?
Yes. Yeah. See, how to overcome with the abnormalities. So again, suppose if there is a take the example of some medical condition. Suppose the person is having sciatica, and this sciatica is cause of low back pain. So actually the origin of this sciatica nerve is L4, L5, S1, 2, 3. L4, L5 means this lumbar vertebra 4, 5, then sacral vertebra S1, S2, and S3. So this is the origin of sciatica nerve. So when there is a problem in the sciatica nerve, or the person is having radiating pain to the whole posterior region of his leg and in the back, then there may be some kind of compression happening in this particular lumbar or sacral area. So there will be, this may be because of the some disc bulge, there may be it may be related with the disc herniation. So depending upon the kind of abnormality has occurred, so we have to go for the treatment, or we have to go particular kind of therapy for that. So initially, see, whether it is sciatica, whether it is disc bulge, or whether it is herniated disc or spondylolisthesis, one thing what we suggest to the patient is to take rest in very normal posture. When he, in a posture when his spine comes to the proper resting position.
Yes, भैया.
So advising hard beds, sleeping in supine position in hard bed or very firm bed without using mattress, just using a one dari.
Yes.
So that kind of advice we give to the patient. And if he is having severe pain, we advise some kind of painkillers to take proper rest. When the pain is reduced, then we ask to go for some kind of physiotherapy and some kind of guided yoga practices, guided exercise to have a proper movement, which will further relax the back. So this way we go. So depending upon the kind of abnormality, suppose if there is a spondylolisthesis, then there are particular kind of management for that, because here the vertebra has completely displaced from its position. So bringing
Yes.
that to the position, so various kind of things are required. Some of the time we suggest to go for the this back support also, and there will be traction. And patient has very much advanced, then sometimes it may go to the other like surgical things also. Suppose the person is having Pott's spine, tuberculosis, and that is causing the problem. So we suggest to go for the particular tuberculosis treatment. So depending upon the kind of abnormality the person is suffering with, we advise to go for treatment of that particular problem.
जी
But the
भैया.
good thing here is actually more than 90% of the cases are non-specific back pain. So there is no such severe abnormality which is causing back pain. These cases are less than 1%. Most of the person, they will be having some very general problems, some muscular spasm, some slight disc bulge, some sprain, some strain because of their sudden jerky movement, sudden lifting of some heavy object. So that will
Yes.
cause the back. And in
Yes.
all these conditions, some very normal kind of initial procedure that itself will be sufficient. The other thing is the osteoarthritis. Yes, osteoarthritis is also it is degenerative problem. When osteoarthritis is happening in our knee joint, the same kind of pathogenesis is going on in our, or same kind of degeneration is going on our vertebrae and in our intervertebral disc also. So degeneration is a natural occurring things in our body, and this is happening in our low back also. As the age is advancing, the joints, they are becoming weak. Similarly, our back, that is also going in degeneration. The disc will go in degeneration. The vertebrae will go in degeneration. So these are osteoarthritic changes that are happening in our vertebrae also. So only we have to involve in regular physical activity to support our back muscles, to support our these all spine and structures which are supporting our whole vertebral column. So that all will help us that even with some degenerative changes which are occurring because of the aging, still we can maintain our whole spine in proper posture.
Yes, Bhaiya. Thank you very much for so much clarification. God bless. Thank you. Thank you, Bhaiya.
Hello. Hello.
Sir, namaste. Namaste, sir.
Hello.
जी विनोद भैया नमस्ते, चंद्रकला दीदी
नमस्ते नमस्ते। मैं बात रखूं क्या?
हाँ भैया रह सकते हैं, चंद्रकला
जी
दीदी
जी भैया प्लीज।
डॉक्टर साहब नमस्कार, नमस्ते
जी जी नमस्ते भैया।
It has been very nice and educative, and I wish to remain connected also and learn. And I am one of the prospective patients, and but I am a person plus 70 years. Okay, but I am in exercise also, but I have got sufferings also, and particularly lumbar region. And it so happens I am using hard bed, doing exercise also, sometimes Surya Namaskar, sometimes cycling once a day. But still, it so happens at the end of the day, you know, as we have got toys, playing toys, and we feel कि spring loading कर दिया, and after some time the energy get lost. So towards evening, there is a back pain, and to the extent that I have to take support of some stick. Okay, but during the course of night, it gets regeneration takes place, and in the morning it's very nice. So could it be possible? I wish, number one, if I wish to read whatever contents you have delivered and the precautions that we have to take, so where from it will, how we can get connected, number one. Number two, what we have to take as prevention, immediate and long term.
Yeah. So actually, Bhaiya, there may be, see, as the age is advancing, there may be some degenerative changes which are occurring. So have you undergone any kind of MRI, X-ray, or have you
No, not so far.
For this?
Not so far, but if you advise, I will kindly place your contact number.
Yeah, sure.
And whatever you advise, there is absolutely no problem.
Okay. So what I guess with your whatever you have expressed, the problem may not be very severe in nature. It may be just
it is not a very severe thing, and
it is just like the whole day when you are working or you are involved in some kind of activities, evening you may be feeling some pain in your low back.
You know, I had a problem of chikungunya, and during that phase, I got this thing developed then onwards. Chikungunya, and I have got as such, I have got varicose problem also. But in varicose, I don't have any problem with varicose, but the bulging veins are there. So I am just doing massaging, and from bottom to top, and almost every day.
Yeah, this is very good practice which you are doing.
And I am keeping my ankle a little higher than what normal is
Mhm.
for some times. So as such, exercise also I am performing day-to-day basis,
Mhm.
a little pranayam, little stretching, relaxing, then even Surya Namaskar sometimes. But in the morning, all those performances are possible. It so happens that there are days when morning is also tough, but it's okay. Because we have to respect our age also. I am plus 74.
Yes. Okay.
But I am getting connected with UHV contents for last number of years. And
Very nice.
in the morning also I hear Dr. Sharmila Didi and all.
G. Yeah, Sharmila Didi is also involved in this holistic health program. And
Yeah,
many
yeah.
times she also takes the session. So it's very good, Bia. Bia, as you are already doing this full body oil massage, you are doing yoga practices.
Yeah.
And yeah, you are aware of your posture also whenever you are walking, sitting.
So I
And
am
even
normally sitting on the chair without rest at the back.
So you are keeping your back straight, okay, and you are using the hard bed, not very cozy bed. So these all
Not
are
very
the
cozy. Not very hard, but not very cozy.
So actually these all are sufficient here. But if suppose if the pain is causing some trouble, that it is making you difficult to go for the toilet or go to even the normal activities, then I can suggest some of the very initial kind of medicines. So I will share my number, and if it is causing some problem, you can personally contact so that I can
Kindly.
some of the initial management.
So, and
Yeah.
whatever you have presented, if I wish to revise it and go back to it, and
It will be there in YouTube, so you can go through it. Yeah.
Hello.
And I have
Namaste,
shared my
sir.
number. So most of the things which I discussed here in the preventive aspects already you are doing. Yeah. So I don't think that much is required, and even I don't think that you actually require much of this medical management also. It is just you get some slight discomfort in the evening time, and which resolves automatically by taking proper rest in the night. So I don't think that actually this is a very serious issue. This is generally happens. So little bit extra care when we are sitting, when we are walking, or even like when we are involved in some kind of activities. If you feel some discomfort, we can further in the daytime also, we can take some half an hour rest, going to the bed and lying down in the supine position. So these all the things initially I can advise you. But suppose if it is causing some extra discomfort and making you little bit worry about it, so I can suggest some of the very simple medicines for that. The one more thing is, if there is a constipation, so please take some laxative, or please see your diet, which should have enough fiber. Many times this constipation will also be one of the cause of this back pain because of the overstraining and sitting over toilet for a little longer time. So that also we find. Another thing is the footwear. Please check your footwear. So see whether your footwear is the right footwear for your health or not. So
okay, as such, I don't have any problem of constipation.
okay.
I don't, because of whatever input I give to my body, I know what I am taking.
See your footwear, so whether you are wearing right kind of footwear or not. And if these things are not related with your back pain, then you may require some very initial kind of medicines. When you will contact me in my shared number, then I will suggest you.
So number you are putting on chat,
So I
na?
shared.
On chat?
I shared in the chat box.
It has not come as yet. Because I had placed this on chat.
Okay. Yeah. I again shared my this email address also. Yeah.
Hello.
जी भैया.
Namaste.
Yeah, number is there.
हाँ.
Number is there.
जी. In the
Namaste,
chat
sir.
box it is shared.
Chandra
जी,
Didi,
please.
namaste. Welcome.
जी दीदी नमस्ते.
Namaste, sir. Namaste. Sir, I'm Chandrakala.
जी.
I have a low severe back pain from last 10 years, sir. 2013. I was gone through that slip disc like 2 times. I gone through that physiotherapy, and later I came to know that I have to change my working style, and the reason due to which I was suffering. So then I started to do some pranayama and like Surya Namaskar and walking regular. Those things I practice, and so that I manage from these days. And last 5 months back, I gone through that the Panchakarma Chikitsa for my back. So after that, I noticed that I was so comfortable, sir, compared to earlier days. And again in the semester work, from last month, because the work schedule, again because of that work pressure, when I get more, when I start to do more work and with the pressure, so I observe that the pain is more, sir. That is the one observation I noticed. And also because of that work, I could not get a time to do my exercise, and I am not getting conscious about my diet. By the time also it caused a more problem. So I was increased to 2.5 kg weight, and I'm not constantly doing that pranayama and yoga exercise and all. That's why from 15 days I have a back pain, but like last 4 to 5 days it was so severe. I listening all the THV classes by on the bed only, sleeping, like in the state. That is that is how I am suffering. I got that X-ray copy. The doctor told that it was bulge. My spine is bulge, and it's like a bending. It's bended, sir. It's not narrow exactly. That is the issue. And they want that if you gone through once again the slip disc again, because of any reason it is so severe, you should take care of that. So that is the issue. And I, in the early age, like 41 only, I gone through that menopause. And also I have a issue with that knee pain, like a degeneration of that bones, joints particularly. And so they suggest to reduce the weight. So now I am in that path, but again it will be fluctuating, sir. So these are the my issues, particularly related to the bone. I suffer a lot from 10 years, sir. So for that bulge spine, or maybe the bended spine, I whatever in the lecture I gone through that, so I know that I observe that the stress and the food, everything we have to take care. And even I know that I have to take care of my posture or a gesture. I couldn't, so I bended my body while sitting and all. So those mistakes I repeatedly doing. So, sir, for bended spine, how should take care? Because I know that this should be managed. I think a permanent solution. Nobody suggested permanent solutions until now.
Actually, the back pain is, again, as I told, that it is one of the very common recurrent problem. The recurrence of back pain is very common. The person will get rid of the problem. See, when the person is having back pain, he will be very careful about everything, about his posture, about his diet. He will even do his some basic back strengthening exercises, everything. Once he will get rid of the problem, again he will be less aware, or he will be a bit careless also, involving in again same kind of things. Because see, when we are healthy, we do not feel about our body and our body parts. Suppose if there is a headache, then only we feel there is a head. When there is a pain in our finger, then only we are aware that I have this finger. When there is a back pain, then only we see that there is a back. So if we are completely free, many a times we neglect. So actually, there is no such very severe problem in your case, and it is good that you underwent some of the therapies and you got satisfactory relief from that. And you know the reason also why it developed again, why there is a recurrence. The reason also you know, and the solution is again the same. So making some changes in the lifestyle, sitting posture, dietary habits, and again avoiding the stress. So that itself will give you a relief. And again the proper rest. So proper rest of your back, proper sleep in the night. So that is again, it will be helpful to reduce the stress, and proper sleep in the night. It will give proper rest to your back. So these all are the initial thing. But suppose if your pain is severe in nature and it is affecting your daily routine, then we suggest some of the painkillers also. There are herbal drugs which will be helpful for pain relief. So like some of the very common drug we use is the gugulu. So gugulu preparations are there, and the shallaki is there. So these we initially suggest if there is a pain which is causing much trouble and affecting the daily activities of the person. So suppose if this is the situation, then you can go for at least for 1 week for these some painkiller, and you can again contact me. So I will suggest you some of the very safe pain managing this medicines. And I think with the corrections of your lifestyle, dietary habits, that will resolve your problem.
Yes. Thank you. Thank you for taking this topic discussion. Thank you very much, sir. I will contact you, sir.
Please. I have shared my number.
Yes.
Nice. Thank you, Didi, and thank you, Akhilesh. So it's really time, and let's respect the circadian rhythm also. And Didi, it's okay if we take the session, your question next week, or you may contact Akhilesh Bhaiya separately.
Bhaiya, what time will suit you, Akhilesh Bhaiya, to contact?
Bhaiya, actually Sunday anytime you can contact, and other days after 6 o'clock it will be or morning between 8 to 9.
Okay.
Because 9:30 to 5:30 is the college hour.
Okay.
After 6 and 8 to 9 in the morning hours. Sunday you can contact anytime, Bhaiya.
Okay. Thank you.
And you can drop me the WhatsApp message. I have shared my WhatsApp number. So WhatsApp message you can drop. Then I will.
No, I have shared my number.
Okay, Bhaiya.
I have shared my number, and I am at Agra. And where you are placed?
Presently, I am working in All India Institute of Ayurveda, Goa, North Goa.
Okay.
Bhaiya. So,
okay. Thank you.
You can share, Bhaiya.
Nice. Thank you. So thank you all the co-explorer, and thank you, Akhilesh Bhaiya, and see you all again next week for the more co-explorers. Thank you. Namaste.
Thank you so much, Bhaiya.
Namaste. Thank you, Bhaiya. Namaste.
Namaste.
Namaste, Bhaiya.
Namaste.